Hello, hello, hello. Assalamu alaikum. Jianu pakhair agale niyama chune shumne. Wash maleo hi godzaimas, hi hugs and hellos to everybody who's tuned into PTV, PTV Global, and are watching World this morning alongside Shahzad Khan and Maha Makhdoom. And I do not sound right?
No, you don't. Shahzad's not feeling very well, but thank you so much for being here today. It's always
perfectly
good to
all
have
right.
the team together.
It's perfectly all right, and you know, it's always lovely to be on the show. I think this is how I want to start my show every day, and my day too as well.
Exactly. But you know, how was your weekend? I mean, it kind of looks like you had a good time.
Yeah, it was superb. Edward Maya was in town, Kantik was in town. I was hosting those shows. You know, the audience was fantastic. I think TMUC audience even rocked as well. So you know, it was some good time.
Excellent. But you know, obviously the weekends are there for relaxing. It's about letting go. It's about kind of enjoying yourself, especially after such a hard week.
Do that.
No, you had to.
I was working.
You were working, but that's very good. But today, you know, we also like to kickstart your week with information and give you entertainment. But today, we've got an important subject to highlight. We did a show, but we started this a couple of years ago, and every year we try to highlight it because it is something that people don't know about. It is something that is not in the masses, not in the mainstream, and it is things that are affecting people in the world. Not a huge number of people, but the fact is, even if one person is suffering, that's enough for us to take notice.
Exactly, and then at times you might see people who actually walk like as if they are drunk, but then at the same time it's not that they have literally been drunk or intoxicated, but then it's just because of the fact that they are suffering through this situation or probably a disease which is known as ataxia. It can probably affect your hearing, it can affect your heart, you can be involved in your different heart diseases as well, but it certainly attacks your brain. Now what is it? Because they say that the cure is not there. So it's the International Ataxia Awareness Day. We're here for the awareness.
It was over the weekend.
Yeah, it was over the weekend. It was on Sunday. But now today we thought, just because it is very important to highlight, just because people do not know what ataxia is, so we have got our panelists over here.
Exactly.
We have got somebody who's actually going through that situation.
Exactly, and the thing is that, you know, it is a loss of muscle control. It's about losing all, you know, ability to kind of function in a normal way. And so, like Shahzad said, we do have wonderful panelists in the studio. We have been joined by Haji Babar, who is a patient of ataxia. Assalamu alaikum, good morning. Thank you for joining us.
And you know, he's been running his own foundation with the name of Binadam Foundation, and he's the first one within Pakistan to create awareness amongst all those people who never knew what ataxia is.
Exactly. And you know, even our first show, you know, was picked up in America as well, and you know, lady was really, you know, she had 3 kids with it as well. Okay, besides Haji Babar, we've been joined by Dr. Mansoor, who is a neurophysician. Assalamu alaikum, good morning. Thank you so much for joining us. Besides Dr. Mansoor, we've been joined by Dr. Sabahat, who is a psychiatrist as well. Assalamu alaikum, good morning.
Thank you.
Thank you so much for joining us. So let's start the conversation. I think I will start with you, Dr. Mansoor. Ataxia, tell us a little bit about it.
Ataxia is a term that is used for neurological disease which affects the brain and which shows itself through impairment of speech or balance, posture and gait.
Okay.
So when the patient with ataxia, he speaks, it appears like he's scanning the words.
Okay.
And when he walks, it appears like he's drunken.
Okay.
So he sways right and left here and there. And this is the basically loss of the coordination and balance.
Okay, but then over here, you know, I've got a bit of information which I would love to share. I think I'll read it out for people. At first, ataxia causes problems with balance, coordination, speech. Then the symptoms can begin at any age. Sadly, loss of balance is just the tip of the iceberg.
Okay, and on that note, we actually have a video that we're going to share with everyone.
All right. I cannot hear that.
Yeah, exactly. It's not very clear in our earpiece, but let's go take a look, and when you come back, let's continue our conversation.
What is ataxia? Ataxia is a debilitating illness which affects a person's ability to walk, speak, see, and swallow. Ataxia has no prejudice. It affects both young and old, rich and poor, men and women. Ataxia can be inherited, but it can also affect someone who has no family history of the disease. Ataxia is life-altering, and many will lose their fight prematurely. Yet one of the most frustrating things about ataxia is that very few people have heard of it. So those that have ataxia spend a lot of time trying to explain what's wrong with them to everyone else.
Okay, so that was a little video for you just to show you a little bit what is the situation. So Shahzad, you were asking.
Yeah, okay, so I'll move on. So they say that, you know, when you get that slurry type of walk, that means that it's just the tip of the iceberg. And then with the most common ataxias, the outlook is bleak. Heart diseases, diabetes, and other debilitating conditions can follow.
Yeah.
Now, what are those conditions, Dr. Saab?
This which you are talking about is about hereditary ataxia.
Okay.
So there are many causes, among them hereditary or genetic are the one. So these genetic ataxias, here you can have these involvement of the eyes, involvement of the heart, you can have cardiomyopathy like weakness of the heart, and then you can have diabetes.
Okay.
So these are the...
So how many types of ataxias are there? So one is hereditary, this is what you mentioned,
yes.
right?
Others are like which affect the part of the brain which is called cerebellum.
Yeah.
So structural damage like stroke can cause ataxia, like infection involving the cerebellum can cause ataxia. Then there are some nutritional deficiencies like vitamins and other things which can cause ataxia. Then some endocrine disorders that can cause this ataxia, and some toxins like alcohol.
Okay.
That can also cause.
Okay, so basically it can be triggered by anything, and if you have a genetic predisposition to it, then you will trigger it off.
Mostly this genetic one which is more debilitating, and it is progressive and it is incurable.
Oh my God.
Okay, now let me move on to Haji Saab. So you have been suffering from this for how long?
I'm suffering from how long?
Yeah, how long has this been going on?
No, it's I think 8 years.
8 years.
8 years long, and after the marriage, after first year, my daughter birth. First of all, I had to spoken problem, and I speak. People don't understand. Sometimes they said, okay, you have to drinking and something problem. After that time I suddenly fall. I walking just a normal balance and this type. So then time by time it's worsen, and the walking and the speaking problem. So much problem. Then it late. Now you have to see, you can see my, from the last 3 years, I'm doing this awareness program by help you. So it's a very down my health.
Okay.
Yeah.
Okay, so you've just explained. So let me bring Dr. Sabat into the conversation. So this has been going on for 8 years for Haji Saab, and also he, you know, it started off slowly. People, you know, accused him of different things. So psychologically, what happens to that? Because this is a very, I mean, it changes your whole entire life.
Well, okay, as Dr. Mansoor has said that the part of the brain that is called cerebellum, it's involved in the pathology of this disorder. So cerebellum is not just a part of the brain that is your motor house, I mean that controls your motor activities of the body. It is also responsible for your emotions, for your personality, for your behavior and coordination.
Cerebellum itself.
Definitely, a lot of other parts too, but cerebellum has contribution in your personality and all the other like aspects I have mentioned. So as a psychiatrist, I would say like it has a like debilitating effect on the quality of life of the patient. They have effect on their personal life. They have definitely, there is a strain in their personal relationship, then there's a strain in their working capacity. They lose the jobs, they have difficulty with their spouses, their children, and they cannot just act like a normal person. So it's just not about patient, it's about everybody who is related to the patient with ataxia.
Okay, yeah, exactly. So that was the next part of the question, was that, you know, for the person themselves who's suffering from it, it's, you know, it's a life-changing thing, it's very difficult. But what about everyone around them? Because like you said, it's very challenging. It's, you know, constant care, constant supervision.
And how they affected psychologically as well.
And it causes definitely there is a lot of burden on the family too. You know, they have to patient gradually develops physical disabilities, emotional disabilities, and the family has to take care of the persons, and slowly, gradually they get exhausted. It's not just about the ataxia patient. At times the family also go through the depression and psychological stresses. What I can highlight is the most important aspects of ataxia, of psychiatric aspects, are depression. In that, patient would have low mood, they have difficulty in communication, they have difficulty in social relationship, difficulty in working, they will lose all the pleasure and interest in their life, there will be sleep disturbance, and the most important aspect is the cognitive disability. And now I will just explain what is cognition. Cognition is the mental process by which we acquire knowledge and then we process it through our thought, our senses. So definitely he cannot coordinate with his cognition and then his physical symptoms. So it's going to like affect his attention, his multitasking behavior, and his suppose if a person is doing a good job, but due to a decline in the cognitive ability, he cannot process that, he cannot memorize that, he cannot communicate it. So there is a great burden on the person itself.
Okay, but then Doctor, moving on to you now, what I want to know is that for somebody who is actually suffering from ataxia, is there any age limit, is there any age cap that, you know, okay, after 15 anybody can get ataxia, or after 20 somebody will get ataxia, or anybody can be born with ataxia?
There is no age is immune.
Okay.
It can start from childhood or may appear in adulthood, like in teenage and even in later age like 40s and 50s.
Okay.
But the causes are different.
Okay.
If it starts early,
we will talk about the causes, but the only reason why I asked about it is that I wanted to move back to Dr. Shahzad over here. And what I wanted to know was how would it actually psychologically impact a kid and then an adult, because there's going to be quite a lot of difference, and then the family is going to feel the difference as well. So how does it act or probably have an impact on those little kids who might have ataxia as well?
Well, it's a good question. I really appreciate that.
Thank you very much for that.
Generally, when we talk about psychiatric terms, we psychiatrists have a great difficulty when we deal with the kids. Because as an adult, we are able to express our emotions, we are able to express our emotional pains, our difficulties, but kids cannot do that. So all the time, as I talked before, like the most striking psychiatric feature of ataxia is depression and psychological stresses. So kids cannot express the depression, and that goes like unchecked, that goes unaware, and they will have lot of physical symptoms. They will have like physical symptoms, like they will complain a lot of pains, they will miss the school, and they will like they will not play with other children, they will not be interactive with the family. So
and I think that it's going to get worse because of the fact that generally, you know, when you're a kid and if you're suffering through such a situation, that means that nobody knows that you're going through that situation.
Yes.
Just imagine that if you're going to school and you cannot memorize things, that means that they'll say that, okay, your parents are now working hard on you. So what are the very early and the basic symptoms of ataxia so that anybody, you know, if they figure it out that, you know, there's something wrong going on with the kid, they could actually go to the doctor?
Yeah.
Anybody early symptoms?
What's up with Dr. Naseer?
earliest
In kids and in adults?
The symptoms are the same. Like the kid or the adult will appear clumsy. Okay. Like his actions and movements, they appear clumsy. Like he's picking a cup of tea, then he will not be able to reach it directly. As we do it, we just go there and reach. Whereas the patient with ataxia has problem with coordination. He cannot figure out the exact distance, so he may overshoot it, may lag behind. Plus his walk, he will be starting, it will starts with the falls.
So your walk will always be affected in ataxia?
Yes.
Or there can be different situations?
So like coordination.
Coordination is affected, so walk will be affected.
Okay.
So when a patient who develops falls, or he has difficulty in turning or movement, and then you feel that he is swaying, just a little swaying, or when he has difficulty in performing the small toss, then we can
Probably
say that he is having ataxia.
Okay. Okay, now
I would just like to add, as you mentioned about the kids, the symptom that needs to be checked is about the behavior, because as a kid, a patient will not tell you, I'm depressed, I'm a low mood, I have a sleep disorder, I don't want to live. It will be more like a physical symptom of pain, missing the school, and being lonely and not interactive.
Okay, yes.
I would like to add one thing that about my symptoms. About my symptoms. In a childhood, you have to see that case they, from children to adulthood, families say they have a speaking of totapan. I have a totapan. When I speak from the starting from the adult childhood, my parents say that these have totapan. They ignored. But I request all the parents, they should not ignore the totapan. You have to consult doctor and they may be totapan is a disease. That time I had totapan, but after 30 years I have to this.
Okay, but Haji sir, you know, you've been here on the show quite a lot of times as well, and we have been doing shows together. But, you know, for all those people who just tuned in for the very first time and they're watching this show, how did you figure out that you have ataxia?
I feel that when I have ataxia, then I feel. So, what I can say, when you have ataxia, you know, when somebody going to disabled, everybody is shifting their friend is shifting in there with me, family shifting, family beating from me. That's a big problem for me.
No, that is a big problem. What I'm trying to ask over here is that since people do not know about ataxia, right? So then what happens is that even if you're suffering through such a situation, it's very hard for the doctors or you yourself to figure out that what the disease is. So how did you figure out that it is actually ataxia?
Yeah. So when I firstly know about the doctor diagnosis, a non-physical doctor, it's a general physician. Then I have to study from net. So from 1 year I have to work on that net and getting all the information and how many the international organization working about this ataxia. I gather and so I make a booklet, books and so many. So I consult with doctors and with my friends or this, but nobody can know about this ataxia. When I 3 years last year when I came here doing ataxia event, then only 1 to 5% know about ataxia. No, my card is written about all ataxia information. Everybody stopped me to ask me to what is ataxia and what may I give a pamphlet. So that time when I came here last year, it's only 1 to 5% know about ataxia. But I am very thankful to PTV. This year now 15 to 20% know about ataxia. What is ataxia? So you have to when you know there's no medical cure, no nothing.
You have to raise awareness.
You have to awareness about this.
Okay.
Right.
Yeah.
So I would like to thank first of all Mr. Naseer Malik from PTV Home who introduced me, who gave me a reference to Nabil Tirmidhi Bhai. Then he do 2 programs for me, and then Mr. Bangesh. Well, like to thank and you, Mr. Shahzad Khan and Maha.
Thank you very much for that. And then the best part, Maha, I think we should highlight that too, that just because of his untiring efforts, US magazine actually picked up on the show we did last year on Ataxia. He's got the magazine with him and he wants to share it with all of you guys.
I would like to show that this American magazine working on ataxia, and
it's alright, take your time.
This one show about the PT World is the only street television who highlight about ataxia in Pakistan.
Great.
I would like to thank Shahzad Malik and Shahzad Khan and
Thank you very much for that.
Actually, see, this is the thing, and this is why these shows are really important, because it is about highlighting and creating awareness, because there are people out there who, there are things that we don't even know about, which we need to learn about. Now, let's move back onto the living aspect, especially within a culture and society like Pakistan. In the West, they're a bit more psychologically advanced and, accepting and more experimental. Within Pakistan, how would you recommend people handle the situation, Dr. Shahzad?
Well, I'm sorry. Generally, there is a lot of stigma when we talk about psychiatrists, and people just think the crazy people go to the psychiatrist or something like that. But what I would tell you, okay, ataxia is not curable, but all the rehabilitation is possible. All the mood symptoms, your functionality, your cognition, and all the measures that we can take, they all come under the domain of psychiatrist. So it's not just like we should be focused, this is a neurological problem, you're going to a medic or you just went to a neurologist and your job is done. I think 50% job is not done until you are not going to rehabilitate yourself. For that purpose, we call it occupational therapy. In occupational therapy, we will customize the home environment according to patient need. Like they have difficulty in walking, they have difficulty in performing activities, so there could be customized kitchen, there could be wheelchairs, crutches, or the home environment could be just customized in a way that could facilitate them. And when they go through depression, it's not just about taking medication, then it's about counseling, how they improve their
So it's about providing them conducive environment, I think.
Exactly.
Yes.
This is something very essential. We'll further move on to that, but right now, ladies and gentlemen, we have to go for a short break because I need a sip of water and my sore throat is actually killing me right now. Don't go anywhere. Good morning.
Let's visit heaven, a heaven whose next generation will be blind. Come, let's visit Kashmir. This is the future generation of Kashmir, laying on hospital beds, blinded. A weapon called pellet gun is blinding the people of Kashmir, mostly teens and children. Young teens have lost their hopes. They see no future now. Who were these rebels and who did this to them? Is demanding freedom a crime? Every victim thinks. They too had seen dreams, but now their life is dark. The pellets have pierced their eyes, leaving them in despair. Not able to see the world, they are suffering mental agony and pain. With their families shattered, hopes lost, and wet eyes. They're scared to face the world because the oppressors may catch them. The children have lost their childhood, their fantasies. Their mothers are wailing, sitting beside them in hospital beds. These blooming buds will unfortunately have to live a life of misery. The dwellers of heaven are bearing the pain that of hell. But Almighty, no one can suppress these rebellions. Every second hour, pellets rupture and I hear. More than 664 people are hit in the eyes since the uprising and are still counting. This is the heaven Kashmir, yelling out to the world. When cruelty makes flow blood streams, O people, thou shalt witness and tell. It can withstand even an ocean of screams when a heaven is turned into a living hell.
Welcome back, everyone. And before the break, we were discussing ataxia and the situation within Pakistan, what's happening around the world. And, you know, we've been highlighting this for the last few years, and every time, you know, it does get a good response, and we are slowly but surely making a difference. But before the break, we were in discussion with Dr. Sabahat about the conducive environments and making it healthy for someone who's suffering with ataxia, how to live a normal life here. So you were talking about occupational therapy.
Occupational therapy is one of the component of the rehabilitation the patient should be seeking. In occupational therapy, as I said before, we customize the environment and we customize the environment for the patient where he can work productively, and we actually teach the patient how he can handle with all the stress that he faces in coordinating and multitasking. Then the speech therapy is very important. As the patient, already our patient is there, he has speech difficulty. So working with speech therapist, we can help the patient with swallowing difficulties, with his accent issues and all the way. And then there is counseling, because the patient is very frustrated, is going through stress, so he needs to talk about that. Okay. At times, family members do not understand what is patient going through emotionally, and they will just not realize that. So that adds up to the depression of the patient. So counseling can definitely help a patient to go through with this distressful event.
Okay, so then whenever we go through these counseling sessions and the therapies as well, does it really mean that, you know, whatever condition you are in, it's going to stay there and it's not going to get worsen, or it'll get worsen, but, you know, you might prolong it a bit?
Well, it depends, you know. It differs according to patient response. The patient, the doctor, the family, the caretaker, there should be all coordination between of them. It's not just the patient role. No. So everybody has to play the part.
So everyone has to play their part.
Yeah.
Okay, so now that's the psychological and that's the therapy aspect of it. But Dr. Naseer, what about the treatment or the medical aspect? Is there anything that can make the situation easier for someone?
Yes. Regarding ataxia, the outlook is not so much bleak regarding this genetic or heredity. It is progressive, and we have these psychological plus rehabilitation measures, but there are some forms of ataxia which are 100% curable.
Okay.
So,
what are those forms?
Like which are due to vitamin deficiencies, and which are due to toxins and infections, and this. These like one ataxia is because of the alcohol. So when you abstain from alcohol, then you can improve. Like deficiencies of vitamin, if you restore it, the deficiency, then you can improve that.
So how do you find out what deficiencies you have there? What kind of tests are available?
There are, when a patient
vitamin B12?
Yes, B12, vitamin B1, vitamin E, some coenzymes. These deficiencies they can cause, like plus endocrine disorder like hypothyroid disorders that can cause. If you treat the disorder, you can be 100% cured.
You can be dancing again.
Okay, so but what other tests are that in order to find out what deficiencies you have?
We do a battery of tests that include the blood test plus imaging of the brain.
Okay.
So because cerebellum is the part which is affected, so we do the imaging as well to see that whether there is some problem there. Sometimes another thing is that ataxia can be a manifestation of some other disease like cancer elsewhere in the body, yes, which is called, as we call it, as paraneoplastic.
Okay.
So cancer is lying somewhere in the body, and it is manifesting as ataxia.
Okay, so that can, so it can be also a mask for other issues. Okay,
so when we do the test, we look for that cause as well. If we treat that cause, it will be improved.
Okay, now in regards to all these testings and these procedures, is it an expensive process?
Yes, medical care as a generally is expensive.
Yeah, there's one hospital, there's somewhere, right, you know, initially in Pindi. I think they're very expensive too. Just don't want to.
Even in
your
of the healthcare system in Pakistan, the basic care that we get at elite tertiary care hospital, that is a standard healthcare at the West.
That is, I mean, what we need to figure out right now is, since we're talking about awareness. I mean, imagine for somebody who is suffering through ataxia already, he cannot work. How is he going to earn? And then if the, you know, if the dilemma is there that the healthcare is so expensive, how do you think that he or she will be able to figure out that which way to go, which way not to go, and it is going to impact them psychologically more and more, and they're going to get more negative as well. So Haji Saab, how do you figure it out for your own self?
Okay, there's a lot of work still pending in Pakistan for Ataxia, because you know the diagnosis system not still available in Pakistan, only the 5 to 6 countries in the world where you have to genetically diagnose.
Okay.
The people are requesting me, give me the patient, how many patients. So I'm requesting those people that in Pakistan they have no genetic machinery. You have to do first the genetic machine in Pakistan first come, then you have to do the work. And people are for getting a degree or doing a research, but just research and getting a degree, they ask me to provide me the data. So I think this is a wrong way to people. They do the right thing. You know, I have 2 books written from last 3 years, Ataxia and Ataxia. People don't understand about my language due to my language Ataxia. They have to ask, I will provide them freely. It's available on my social media, Facebook. And recently, with the help of Dr. Mansoor, I did 1 page on Ataxia in English. And you have to write in Urdu about Ataxia. So that's thing you have to do a lot of work still now. Because when I did the last show, 10 to 15% Ataxia. Then when I did the second program, 20 to 25. Now almost near about 50%. Because you know, among the 10 million people, only 10% this problem.
Okay.
So I would like to thank Ataxia UK, National Ataxia Foundation, America, and FARA.
And we would love to thank you for putting up such a fabulous job as well. But moving on to you, Dr. Shahzad over here. Now, what I want to ask is that, you very rightly mentioned that, ataxia patients can actually fall into depression as well, and that they might have emotional disabilities. Okay? So then, but the way ataxia has actually impacted Haji Babar Naseer is a very different situation. He's very pro it, he's very positive with it, and then he's always fighting, he's always standing up, he's coming up with all of these pamphlets, books, he wants to play his role. What happened over here within this situation?
Well, not everybody would be victim of depression, you know.
Okay.
The depression prevalence differs. It depends upon your personality, your upbringing. It plays a vital role.
Okay.
Like if I'll say like all of we are sitting like 10% in the room, if we go through a bad event in the life, not necessary that all will be victim of the depression. It's about your coping skills and your aptitude, how you look at the life. So I think personality plays a role. What was his pre-morbid personality? He might be optimistic, ambitious, and a strong person. That has helped him a lot. So it's again the personality.
Okay,
Wow, great, man. So that means that you've got a great personality.
Very positive.
Yeah, but Dr. Saab, now what I want to ask you is, since there's no cure for it, first of all, that, definitely gives me a bit of a jerk of depression as well. But then at the same time, how do we prolong it over life? Are there any medications other than the therapies? What can we do? Any exercises? We'll keep on doing them again and again. And will it get worsen over time or it won't?
Yes, these hereditary ataxia, they get worsen over time.
Okay.
But we can teach the patient the skills like walking skill, like he is using a cane. So with this, he is helping himself. Then speech therapy, then some medications can also help. We can improve his quality of life. That we can say that we cannot cure, but we can improve the quality.
Do we really have to take like medicine regularly? Is this
Yes, you
that kind of
have to
treatment
be with the doctor, and he can be changing the medicine as per your requirement, or we will be offering the symptomatic treatment. There are 2 types of treatment. One is curable, disease.
Thank you for telling that. Yeah.
And the other one is symptomatic. We treat the symptoms, we make the life comfortable, we improve the quality of life.
Because gradually then what will happen is that, for example, if you're suffering from ataxia for 20 years, I mean, if you were on the first part of the medication, obviously your immune system after 5 years, 6 years, 7 years is not going to treat you with that. So then there'll be changes of medicine as well over the course of life.
Over the cost, you have to change. And regarding one thing, about the cost of healthcare, still in Pakistan, it is less than more advanced countries. If you visit like UK or USA, you cannot sustain healthcare without insurance.
But at least for all those people who are still with the NHS, they get it for free.
Even but who knows how long that's going to be around for.
Yeah, that's what I was saying. But you wanted to add on to something as well.
Yeah, it's like the point you raised. It's not just about seeking one's medical care. I think there are a number of components. Neurologist or physician, then there is involvement of psychiatrist, occupational therapy, then there is orthopedic care, then there is a physiotherapist, physical care, and supplementation have a very role. As Dr. Mansoor said earlier, vitamin B12 and vitamin E has a great role. As a psychiatrist, I just run this test in my patients, and I'm so amazed, like 50 to 60% patients have B12 deficiency, and they just, it get worsened with their depression and everything. And I would just like to add one more point over here. Ataxia symptoms can be worsened by fatigue, by stress, by anxiety, by depression, and even the improper use of the medication that are prescribed for sleep disorder, for depression, and the mood. So it's a very tricky. You cannot self-prescribe. You cannot adjust the dose yourself. At the times, patient take the medication for the depression, but it gets worsened.
So just don't be
they're
your
very
doctor.
Sensitized. No, ataxia patients are very sensitized with depressant medicines. It's very tricky. So I would just recommend they should go hand in hand with like a collaborative.
That's what I said.
So so stick with your doctors as well.
One thing Dr. Mansoor will be agree with me that you can do self-diagnose. Just a matching finger. If you have a direct, you have to direct me. That means sometimes you have no direct. If you have a problem like this, if you have a problem like this, the fingers moving, then they may be.
I mean, there are signs and everything, so pay attention to the signs. And if you do start getting aware, do go to the doctors and consult them, psychiatrists, neurosurgeons, etc. But thank you so much for your time.
Neurologists as well, because these
obviously everybody.
Yes, great.
And doctor who can diagnose and then.
Exactly.
And I would like to add, good friends, families who support you, who understands, to talk to them. If you cannot go to psychiatrist, cannot afford them, talk to your family, talk to your friends.
Exactly.
All right.
Wonderful.
And Dr. Sahiba very rightly mentioned that please don't be your own doctor, because over here in Pakistan, we take medication by our own selves.
Self-prescribed.
We buy Xanax. Xanax is just being taken like, breakfast or dinner. Like that.
So,
but Xanax is something.
So no self-medication, that's illegal. And, go to your doctors before you do anything. Don't do that because you'll probably make the situation worse.
And do check out Binadam Foundation.
Exactly. We'll give you all the links on our website, so that do log onto our Facebook fan page.
Which is with the name of World This Morning.
Our Twitter page.
World This Morning without a G.
Our YouTube and Daily Motion
World
page.
This Morning once again.
And the repeat is that?
11 p.m.
Have a wonderful day, and we'll see you bright and early tomorrow.
Till the next time, 1, 2, 3, good morning.